Hi, I'm Dr. Janssen. You know, I have patients come in and they say, I think I slept wrong. I got a crick in my neck or my neck's stiff and I must have slept wrong. Okay, maybe they did sleep wrong, but the bottom line is on that is that that is something that's been building for a period of time. And the muscles get tighter and tighter, and maybe the posture at night isn't good until it escalates to a certain point where it creates a symptom complex. Okay, I use the tea kettle as an analogy. Nobody knows when the water goes from 150 to 160 degrees, but everybody knows when the water boils because that's when the tea kettle goes off. That's when we have symptoms, when the tea kettle goes off. Okay, so there's two common reasons why people can have that. Number one, your pillow. What happens is your pillow and your bed is there to support you and not make your muscles work during the night. If they're working during the night, after a while, when you get into my age bracket, okay, you've been doing that same stuff for a while, your muscles say, hey, buddy, okay, it's a wake-up call, tells you that something's wrong. The other thing that happens is that people sleep with a fan on over the bed. Okay, some people use it for white noise, some people got to have a tornado in their face. Okay, but what happens is that most people have trigger points, and trigger points are a muscle problem. And it's commonly, they have trigger points in their upper torso and their neck. And it's more common to have it on the dominant side, if you're right-handed, the right side, than it is the non-dominant side. So what happens is these trigger points can get aggravated by a cold draft, whether it's at work, whether it's at rest, okay, a fan over the bed, whether you've got an easy chair at home that the fan blows on you, okay, those are things that escalate that. Or if you are running across the parking lot, you get rained on, and then you go in the freezer section of Publix and see a friend of yours that you haven't seen for a year, and you talk to them for 15 minutes, that almost guarantees that you're going to have an escalation of trigger points. Not while you're in Publix, but sometime in the next few days. Okay, so people come in, and when they have these cricks in their neck, almost always there's a muscle problem and there's a joint problem. So you need to address both of those issues. Now, if they come in and they're all torqued out in their neck, no, we don't want to crack their neck because that's not comfortable for them. It's bad for business because they don't come back. But we still need to do something to get that, okay, the joints in the cervical spine moving better. That's why one of the ways that, or reasons why we do the pulse star. Okay, so the other thing that turns the trigger points from an active phase to a latent phase is an isometric muscle contraction. So you're leaning on your left arm like this while you're watching we don't want to say hockey game because that's over, okay, but you're using the remote control, okay, or you're always working your phone and you're leaning on that left shoulder, or when you're sleeping on your side, you're scrunching your ear and your shoulder together. Those are all isometric muscle contraction. Or you drive and you're leaning like this. That's an isometric muscle contraction, and it's not a question of whether or not you're going to have an issue with that. It's a question of when. So I'm Dr. Janssen, your Clearwater chiropractor.